Situation analysis. In this section, we're going to look at situation analysis in community health practice. A situation analysis is a systematic collation and study of information to identify trends, forces, and conditions related to the problem you are trying to solve in a community. Situation analysis deals with where are we currently. So situation analysis can be applied in other fields, such as marketing, such as health statistics, health system, almost in all fields. Health situation analysis can be applied because it looks at where are we currently, trying to determine you want to solve a problem, then you need to really know where you are so that you can tackle the problem. So situation analysis is very important tool in community health practice because you want to solve a problem for a particular community, then you need to know where they are currently so that you can know how to tackle the problem. Let's look at the definition says is a systematic collection. You have to collect information systematically, scientific wise, and study of these informations for you to identify trends and forces and conditions related to that problem you are trying to solve. So a situation analysis is like you taking a good look at what is happening right now so that you can figure out how to deal with the problem. So in a simpler term, we can say that situation analysis means asking questions and collecting information about the current situation for you to understand what is going on before deciding what to do next. So therefore, it helps us to understand where we are currently in that problem. Or in other words, what is the status of that problem right now? So that's what situation analysis generally is all about. In short, the situation analysis answers the question, where are we now? That's just what it answers. Then let's look at situation analysis in the community health context. In the context of community health, because in community health, what we're most looking at is the needs of the people, needs of the majority, the problem that's affecting the majority of people in the community. That is what we are interested in community health. Because in community health, the essence is to carry everyone to a level of health that allows them to live a socially productive life. So you are responsible for the blind, you are responsible for the deaf, you are responsible for the old, you are responsible for the young, you are responsible for the adolescents, you are responsible for women of childbearing age, and all of that. So you are the one that is trying to allow everyone to have a level of health by integrating everyone, allowing participation and allowing contribution, and seeking partnership and stakeholders to help you give everyone that level that would allow them to live a socially productive life and attain, your main aim is to attain a certain level of community health that allows everyone to live a productive life. So situation analysis is geared in community health to identify those major problems that affect the people and their health needs, such as lack of pipe-borne water, lack of education, lack of basic amenities. So we are applying situation analysis too, because when you do diagnosis, find out problems, you materials rank and look at the likely problem you have. It's also important for you to do situation analysis so that you know where we are in that problem. And situation analysis can also help us to monitor the progress of the program we already have conducted or intervention we have put in place. So, situation analysis in community health context involves a thorough evaluation of the health needs, health status, and resources of a specific population or community. And the purpose of this analysis is to identify and prioritize the health issues affecting the community. You cannot solve all the problems. That is why you need to do analysis, diagnosis, and all of that. So you can find out the major ones and prioritize the ones you can immediately attack while seeking for stakeholders, partnership, and collaborations to solve other competing problems and needs. So a situation analysis in community health context is a way to understand a community, to figure out what they need and how to support them better. Remember, it's a systematic process. You have to collect information in a stepwise fashion. Let's take, for example, you are expected to examine the people and their needs. So you have to look at who is impacted by that specific issue or situation and figure out what these people want or require. Imagine we are a small town where people do not have access to clean drinking water. You applying a situation analysis would help you identify those in that community and actually have exact information about their needs related to that access to clean water. So then you look at, do they have safe water supply? Do they have information about hygiene? Or do they have infrastructure for water? So that is what situation analysis is likely looking at. One, this example we gave here now, they have a problem, and the problem is that they lack access to clean drinking water. But then we need to look at information for us to know where they are currently. If you begin to examine these residents, you now determine, is it that they lack access to safe water supply, or they do not have information about hygiene, or they do not have infrastructure for water supply? Then you also look at the social and cultural norms of those people. You have to also look at social and cultural norms of that people. These, you already know that situation, you already know that social and cultural norms are the unwritten rules and beliefs that govern how people behave within the community. That is norms, cultural norms or social norms. There are things that people do, but they are not written anywhere. For example, in a particular community, if you see an elder, you must bow down to greet. It is a norm that is not written anywhere. Okay, so you also have to understand these norms because they can help shape the attitude and behavior of the people. Let's say in a community where they use water to wash their anus. And if they don't maintain adequate hygiene, they will continue to have fecal-oral problems. That is why you have to look at social and cultural norm. Remember, situation analysis has to do with systematic collection of information. You have to look at the problem squarely. So when you look at the social and cultural norm of that people, it will help you in designing health program that will align and yet scientific and health what inclined. So that is why you have to look at social and social norms of that people. Then you also have to look at potential constraints, things that might likely affect, things that might likely affect we're going to look at the potential constraints on individual and collaborative change. So you have to look at constraints or obstacles that might make it hard for people or the community to change their situation or improve their lives. When you know these barriers, it will help you in planning effective solutions or interventions. It's very, very important you understand this too. For example, if people want to improve their health but cannot afford healthier food because the cost of the food are very expensive, that cost is a constraint. So therefore, a situation analysis would identify such financial limitation that could prevent individuals of the community from making healthier what choices. So that's why a situation analysis look at it holistically. You look at it holistically to have a an in-depth idea of what you are actually looking at. So we're trying to look at then so you're also going to look at constraints because when you talk about community health, you're looking at both their social behavior, you're going to look at the needs, you're going to look at the problems they have, you're going to look at all of that holistically. So this part we're talking about is about social part of it now. Look at the needs, look at social and their norms. We're going to look at constraints, things that will likely make them not to change or adopt healthy lifestyles. You're going to look at facilitators. And facilitators are those factors that can help people or community bring about positive what changes. When you understand this will help you in designing your program. For example, if you find out that a local leader is highly respected in a particular community, first thing you would do if you want to change their behavior, let's say the problem that community have is change in behavior. You just ability to change what they have been doing for a very long time, which is part of their problem. Then the first thing you would do is to work with that facilitator is find out, since they respect a particular leader, if you are able to encourage that leader to adopt a healthy habit, that would be a facilitator. That would be what? A facilitator. So that is what you look at when you are carrying out situation analysis. Because the people in the community can be passing through issues with needs, the needs are not being met, the health problems, or it could be behavior change. So when you look at behavior change as a problem contributing or forces that is making that problem to be persistent in that community, then there's need to change their behavior. So in planning your program, you have to consider their cultural norms, you have to consider constraints, and you have to look at collective facilitators for changing behavior. So in a nutshell, we can say that situation analysis is a comprehensive examination of the community that helps identify who is affected by an issue, what is their need, what are the social beliefs that might help or hinder the changes, and who do you think can assist in making these changes. In this way, the solution you are coming up with, the health program you might come up with, will be more relevant and effective for the people to be involved. Now let's look at the characteristics of community health situation analysis. Since we already know that community situation analysis is a systematic approach to understanding the health issues affecting a community. Because it identifies the health needs, the resources, the problem, which gives you a leading way to solving your problem. So community health situation analysis have to be participatory and inclusive. You have to engage stakeholders. You have to involve a wide range of stakeholders, community members, and health authorities in that community. There's an organization that is community-based organization that is working in that community, an NGO or a non-profit organization like the Cali Agreement Organization, or others that are having healthcare activity in that community. You have to involve them. You have to really involve them. So in the process, you will have to utilize a participatory method. So, discussing with this focus group and community forum so that you can have their own input and make decisions alongside. When you do this, you foster trust. The next is you need to be analytical. You cannot be analytical when you don't collect data. So you should be able to collect data. Use both qualitative and quantitative methods to obtain the data, such as use of questionnaire, for quantitative use of questionnaire, for qualitative interview guide, focus group discussions. You have to use all of these so that you can understand the problem of the community, the needs. Then, from that information we've collected, quantitatively and qualitatively, you'll be able to identify patterns and trends. Such as what type of disease is constant in that community. What of the demographic trends? You'll be able to find the demographic trends. In this community, women are more. This age are more, and this age are being affected. So that is the demographic trend. Then you also determine the social determinants of health in that community through those data you've been able to collect. Then from there, you can also do root cause analysis, which means investigating underlying issues that contributed to the health problem, such as it could be poverty, it could be lack of education, it could be lack of access to care. It could also be social barriers, such as conflicts or stigmatization. That is why institutional analysis in community, you are going to look at the number of schools in that community, the number of primary schools, number of secondary schools, number of health centers, number of health facilities, tertiary and primary, secondary level healthcare. You're going to look at the type of health workers they have there, their number and the distribution. You're going to look at health budgets at LGA level. You're going to look at the presence of community development committees. You're going to look at the presence of health organizations or community-based organizations. You're going to look at all of this. From there, you can look at the root cause of this problem, and that is known as root cause analysis. Another characteristics of situational analysis is that it should be relevant. for your analysis to be relevant, it needs to focus on current health issues. It should focus on current health problem of that community at that moment or need. And the findings should also be in alliance with what the people are passing through. If not, it will become irrelevant. Then it needs to be comprehensive, that it needs to be holistic in its approach. That, like we explained earlier, you need to examine a wide range of health determinants. What do we mean by health determinant? Those factors that determine level of health in a particular community. You have to look at physical health. You have to look at mental health. You have to look at environmental health factors, You have to also look at socio-cultural factors. If you recall earlier, we've said about that. You're going to look at health facilities, schools, health budgets. You're going to look at presence of healthcare workers. You're going to look at these people, barriers, constraints. You're going to look at facilitators in that community. So you need to be looking at environmental factors, things that influence the environment, the health from the environment. So that waste disposal system, you have to collect data on waste disposal in that community. Let's look at this. Do they have open defecation? Do they have open refuse disposal? All those factors contribute to might contribute to the challenge that people are having in that community, or might contribute to the persistence of that problem. It could be because maybe they have open waste disposal that allow mosquito breeding, that lead to constantly those people having malaria that is killing them. You have to look at this in a holistic way. Then also, for it to be comprehensive, you need to collaborate with sectors. You have to look at education, you have to look at housing, you have to look at employment, because all of these influence health care and health of the people. Then lastly, it should be evidence-based. What we mean by evidence-based is that you need to use scientific method. Remember, you say it's a systematic process of collection of information from the community. So it needs to be scientific. So the forms you're going to use to collect information must be scientifically proven to be effective. You can also do some level of research. Look at peer-reviewed research work and collect data from credible sources to enable you to undergo this. Then for it to be evidence-based, it needs to have continuous monitoring of the indicators of the ongoing assessment. So in a nutshell, situation analysis is centered around participatory engagement, rigorous analytical process, and contextual relevance, which means there is a need for a comprehensive view of the health determinant and a strong foundation in the evidence. So that is what this is trying to let us know, for us to have a good and sound situation analysis in community health. So this is something what we'll be discussing. Participatory and inclusive includes all relevant stakeholders in the health. Analytical, it should be based on contextual framework of how input, process, and output interact with each other. You have to be relevant. You have to focus on issues that ultimately affect the health status of the people. It has to be comprehensive, cover all aspects related to the health, and evidence-based. You have to use a wide range of information and data, both quantitative and qualitative, as well as, and I thought as such, it should be more relevant. Now let's look at components of Component of situation analysis. These are things you must look at if you are doing community health situation analysis. We are narrowing down to situation analysis community. There are other levels of and other situation analysis you can do for marketing, for people who are doing business to find out how to get more customer and all of that. Why they are not selling or what. But in health here, we are much concerned with the health of the community. So this is our area of focus. We've looked at the definitions in general context. We've looked at holism in situation analysis. We've looked at the characteristics and all of that. Now, component of situation analysis, these are likely things that must be in a situation analysis. There must be community profile. You have to understand the demographic characteristics of the community you are doing this program or this process in. You have to understand their population size, age, distribution, ethnicity, socioeconomic status, poverty, rich, middle class. You have to find that educational level, employment rate, the occupation they have there, the vulnerable population in that community, and health disparities. The poor may not have access to tertiary level of health or private level of health care. They may not have access to social insurance schemes and all of that. You need to have that community profile handy. So if you have done the community diagnosis, you have the information handy, you move. So as part of situation analysis, you have to understand the community demographics, and that is known as community profile. Another component of a good situation analysis is that there is health indicators. Because by the time you are collecting all these data, you'll be able to have access to information such as the prevalence and incidence rates on the conditions that are suffering, diabetes, hypertension, mental health issues, infectious disease, and chronic illnesses. You also have data on mortality rates. You have to understand the leading cause of death in that community and how has it been over time. They have to also must have gotten information about the child and maternal health, what the maternal mortality rate is all about, the birth rates, the child health indicators, such as vaccination status. Then you also must have a good data on behavioral health. What do their community consume substance abuse? Do they have smoke? Do they smoke? Obesity and all of that. So it's part of situation analysis. Health indicators will be handy. Looking at the presence of health facilities and all of that in that community. Look at the profiling. Look at the health indicators. This will help you. Then healthcare resource assessment. These are the components. We've looked at the community profiling. We looked at. You have to also look at the health indicators. Then you look at healthcare resource assessment. You have to evaluate the availability and quality of healthcare services in that community, such as presence of health facilities, hospitals, clinics, community health centers, and specialized services and home care. You have to look at how many are there and their number. Then also look at the health workforce, the availability of healthcare professionals, doctors, nurses, healthcare practitioners, and other providers, community workers, and their distribution within the community. If they are more centered in a particular area, others will suffer it. You have to look at this. Then also look at access to care. You have to really understand the existence of barriers, such as transportation. Look at how many hours does it take for a person from a particular community to get to their health center? Presence of insurance coverage. Do they have insurance coverage? Cultural differences. How many persons are affected? How many persons do not have this insurance coverage? And how many persons can afford this transportation? Or is there a free transport system that would convert the people from their homes to their health facility or health center? So all of these, you look at them because they might likely prevent people from seeking healthcare services. Then another component is at the end, if you have collected this data a scientific way, you'll be able to understand the trends and pattern in that community. Be able to analyze the trends over time to identify emerging health issues and shift in community needs, such as changes in the demographic profile, because people every day, births and deaths, migration occur. So the demographic profiles will change, and there's urbanization and all of that. So demographic profile would certainly change. These are very important components of situation analysis. Then in every situation analysis, it's always good to do SWOT analysis: strength, weakness, and threat analysis is very important in community health situation analysis. In another situation analysis too, you have to do SWOT analysis. So there's need to utilize SWOT analysis to summarize the strengths, weakness, opportunities, and threats related to the community health. This would help you prioritize of area of intervention. Which area can you intervene immediately? So all of these form the component of situation analysis. By the time you collect data for the community, you should be able to have a good idea of the community profile. All of this will help either contribute to level of health or lead to deterioration of health. So you have to have a good community profile of that, knowledge of the community profile. Then health indicators, because you're going to be reviewing records from the health facility. Then healthcare resource assessment, very important. You also have to have a very good healthcare resource assessment, which tells us about the availability and quantity of healthcare services in that community. Then trends and patterns. From that information you collect from the hospital, from community profile, you'll be able to say, these people are prone to diarrhea, usually in January. Then you do your seasonal calendar. From the seasonal calendar, you find out, these people are prone to flooding because they live by the riverbank. So that will tell you the trend over time. Last year they had flooding. Previous year they had flooding. Or last year they had drought, and all of that. Or they had a particular disease outbreak. So by the time you look at this information in a robust way, you have a good idea of the trends and pattern in that community. Then you now utilize SWOT analysis. And let's look at what SWOT analysis. First, the X there means strength. So you have to look at internal attributes of that community that will help you to achieving health objectives. Because it's very important. The essence of you doing situation analysis to know where we are currently is for you to intervene. And for you to intervene, you have to look at their strengths. So by the time you have carried information collection and data collection from the community, you'll be able to identify if they have strong healthcare infrastructure. Are there availability of hospital, clinic, healthcare professionals that can provide care? Do they have a strong leadership system? Because if you have a strong leadership, the people always obey their leadership system. As such, if you want to make a public health initiative or community health interventions, it will be easy. So those things, if there's presence of hospital, it means that, let's say you want to do intervention on diarrhea. You already have the community already have a strength because they have a clinic and hospital and have health workers, community workers, who you can approach, use them to do mass campaign or mass education on how to prevent diarrhea or how to prepare ORS at home. That becomes a strength for that community. They have those things. It is a strength for them. If they have a very strong leadership system, you can actually go on advocacy and seek their support in carrying out the health program. It's a strength for the community. You understand? That's the strength. Then look at weakness. That's why we used red on it. It's a weakness. These are internal factors that may hinder progress in the community health efforts. Now, let's say they don't have healthcare facilities, or how can you get people who help you to carry out this teaching? It means you have to hire, you have to move equipment, and all of them are very costly and may not be feasible. As such, it will hinder the intervention you want to carry out in that community. So when they don't have those resources, or they have a poor leadership system, or they are having health disparities such as inequalities, the rich having access to insurance scheme, whereas the poor do not have anyone, or there's a marginalized population, so people are affected, or they don't have they have low health literacy. There's lack of understanding about preventive care and healthy lifestyles among the community members. If they don't have a high level of health literacy, it means that our efforts they might be putting in place to change their social behavior will be resisted because of that constraint or barrier known as low health literacy, because they don't have a good level of understanding about preventive health care. It will be very difficult, and that's a weakness. So whatever that is a weakness, whatever that is absent in that community that is necessary is known as weakness. And then whatever that is necessary for a healthy community that is present is known as strength. Strong leadership system is a strength. Strong healthcare infrastructure is a strength. High level of health literacy is a strength. Availability of resources is a strength. Lack of health disparities and social inequality is a strength. But where there is presence of social inequality, health disparity, low health literacy, limited resources, poor leadership structure is a weakness, because it will hinder effort towards having a robust health program. Opportunities. What are opportunities? Opportunities are external factors that the community can leverage for improvement in their health outcome. Let's say in a particular community, there is presence of an NGO that is working, let's say Red Cross. The community can leverage on that, seek their support and assistance, and improve their health problem. If the presence of schools, businesses, and all of that, you talk about some business like Dangote company also do what's called community initiative. Presence of tertiary institutions like universities is an opportunity, because that university do research and can do what is called community initiative program for projects for that community. So it's an opportunity for that community to leverage on that. Threats. These are external challenges that could negatively impact on the community health, on the health of the community. So that's economic downturn. When the budget cuts in social services or healthcare that hinder public health funding, some policies of the government can be threats to the health of communities, because in a situation of economic hardship, it's a big threat, because things will be very high and exorbitant to afford. Epidemic outbreaks, situations like that of the COVID-19, when it happened, almost many programs were shut down. And you see, when this happened, the people will suffer it, and that's a threat, because a lot of programs that we are helping people to live would be reduced. And people, people we are asked to stay indoors. And this increases the rate of communicable diseases and will overstress the healthcare system. It could also be policy changes, like I said earlier, which can reduce the service availability and accessibilities to those services. So this is what SWOT analysis is all about. Strength, weakness, opportunities, and threats. When you look at all of this, you'll be able to make good how to overcome the threats and have to overcome the weakness. Then make use of the strength and opportunities. So you have to do that SWOT analysis for you to achieve a good level of situation analysis that will lead to an intervention in the community that will improve the health of the community. Now let's look at the importance of using SWOT analysis in community health. It helps you to prioritize your intervention. By the time you have identified the strength, you can leverage on it while you try to address the weaknesses. As such, your program will go. For example, if a community has a strong engagement, but they have low health literacy, your priority intervention must be to help educate these people about the program so that they can use it. That's why it's good to do SWOT analysis, so you can prioritize your intervention. Then SWOT analysis helps you in resource allocation. When you understand the opportunities available, it allows the community to allocate their resources effectively. You understand? Then it also helps you in risk management. When you identify the threats, it will help you to develop a risk management strategy that would reduce the potential negative impact. You have already identified the threats on time. For example, if you know or have an idea that this community usually faces this outbreak, you will now prepare for that outbreak or flooding ahead of time. You prepare, put up mitigative measures, put up resilience measures so that the impact of the problem will not be much. Then lastly, SWOT analysis helps you to do what is known as stakeholder involvement. By the time you have known their weakness, their strength, weakness, opportunities, and threats, you'll be able to have a detailed discussions with the stakeholders and involve them in the program. So these are the components of community situation analysis, community situation analysis. Let's quickly look at it again before we proceed. You have to have a good understanding of the community profile. You have to understand the health indicators. You have to have healthcare assessment, healthcare resource assessment detailed. You also have to know the trends and pattern in that community. Then you do SWOT analysis. It's a very good component of situation analysis to know where we are at the moment. Importance of situation analysis in community health. It provides a framework for identifying key health issues affecting the community and employ a data-driven approach to determine the priorities, things you will do first. It also helps the organization or the community to make informed decisions about their resource distribution based on their needs so that efficiency in the use of funds will be achieved. It also facilitates evidence-based policy making and program development, which will help in evaluating the effectiveness of the intervention and health policies. It also encourages involvement of community members in assessing health needs. Thus, it fosters ownership of the health initiative and empowerment of the population in health promotion. Recall, we said it is holistic involvement of many hands for you to achieve that. By so doing, they will see the program or the project you're about to implement as their own, and they will support you. Then it allows for identification of risk factors and trends, which would enable the development of preventive health strategies needed to solve community health problem. Let's say you identify the trends over 5 years that by January, there is a serious flooding or drought, or diarrhea. It will help you to develop preventive health strategies, things that will help you prevent its occurrence or reduce the chances of its occurrence, or even the impact it will have if it occurs. So that is one of the importance of situation analysis in community health. Now, methodologies and tools used for situation analysis. One, because we collect quantitative data, we employ quantitative methods such as use of questionnaires, review of existing records in the facility, using data extraction forms and proformas. Then we also use qualitative methods such as focus group discussions, interviews. You also use them as a method to extract information from the community. Then also use health survey. All of these are embedded in this place. Health surveys and questionnaire is under quantitative method, whereas focus group and all is under qualitative. Then you can look at GIS mapping. Look at GIS mapping. That is not a geographic information service. It's an application or a system that can be used to visualize health data geographically, which will not help in revealing pattern and disparities across different neighborhoods. Example is that the local or the seasonal mapping. It helps us to visualize what happens in that community, in which area, at certain time of the community. Flooding, fishing, fighting, fire outbreak, pandemic, rainy season, excessive sunshine. But there's an app that helps in this geographic information system, which reviews health data geographically. So these are methods that are employed in situation analysis. So how can we apply situation analysis to community health? One, in public health initiative, situation analysis is used by health departments and organizations to design targeted health program. When we say targeted program, we're looking at program, looking at a particular problem. It can also be adopted for policy development. Situation analysis aids policymakers in crafting relevant health policies that address specific community health challenges and equity issues. When you have had enough information about the community holistically, you do your SWOT analysis. From there, you can say, this is likely policy that will help this community to thrive better. It can also be adopted in grant proposals. It can also be adopted in grant proposals. It also can be adopted in monitoring and evaluation. So situation analysis can be repeated at regular intervals to monitor changes in community health. Then evaluate the impact of interventions and adopt strategies accordingly. So with this, we have come to the end of situation analysis in community health. We'll be able to look at the likely components in community health, the situation analysis. You look at community profile, you look at the healthcare assessment result, healthcare resources assessment, trends and patterns, SWOT analysis, and health indicators or indices. Then we will look at also characteristics of situation analysis in community health, where we talk about it being participatory, analytical, relevant, comprehensive, evidence-based, and we'll finally look at every other component of situation analysis.